So, what about the individual things? So what is the real risk of getting sick? We're going to look at each one of these vaccines individually. And we're going to start with the hepatitis B because that's the first one out of the chute. That's the one they want to give your baby when they're 12 hours old. Okay, that's where we're going to start with that. Well, the disease it's caused by a virus. Symptoms begin with nausea, vomiting, fever, a little bit of malaise. You get sick, you get jaundiced, you look kind of yellow. Recovery is within 4 to 8 weeks. So people get over it. It's like a virus. Now, it's a bad virus. People can get really sick from it. My dad had hepatitis B when I was growing up. Nobody really knows why. I remember him being pretty sick for a while, but he was, he got over it. So people recover from it. Okay? Hepatitis B is usually spread by contaminated blood and blood products, and that up to 70% of all infections are in high-risk groups. Now, what is a high-risk group? IV drug abusing people that use IV drugs, shared needles, homosexual population, people with adverse lifestyles, alcoholics, homeless people, unfortunately for them, but that's the population that hepatitis B is endemic in. So it's not in newborn babies. It's in high-risk groups of IV drug abusing people, prostitutes, people who live on the streets, people that have in the homosexual population. The primary concern that the CDC has is the potential future development of cirrhosis and carcinoma. And because of that statement, they are now touting the hepatitis B vaccine as the first anti-cancer vaccine because of that. Now, what is the real risk? 50% of people that get exposed to the virus don't even know they have it. It just sort of passes on through, and they get lifetime immunity. 30% get kind of flu-like symptoms, and they get over it and get lifetime immunity. 20% of the people that get exposed to hepatitis B get sick enough with nausea, vomiting, they get jaundice, they get all those things to go to the doctor to get diagnosed with having hepatitis B. So only 20% of the people who are ever exposed to this virus get sick enough to even get diagnosed. So of that 20%, 95% of them fully recover and have lifetime immunity. So therefore, less than 5% become chronic carriers, and only 1.5% ever develop liver disease or cancer 10 to 30 years after the infection. Now, you think those people with some of those adverse lifestyles are doing maybe some other things that maybe they can get liver disease and cancer 30 years after they have this infection? Maybe. But again, that because of this, the hepatitis B vaccine is being promoted in the CDC literature and the medical literature as one of the first anti-cancer vaccines. Okay? So that came from the Clinical Infectious Disease Journal. I just think those numbers are amazing. So this is the vaccine. It's called Recomvax. It's the first genetically engineered vaccine because the first vaccine that they tried to use came out of serum of people that had hepatitis B and nobody wanted to take it. Imagine. And they harvest it, they grow it in yeast, they harvest the antigen. The vaccine may have up to 1% yeast protein in it. So how many of those kids get yeasty like real early on that have that, okay? Lots are tested for safety in mice and guinea pigs. I guess that means it's okay for babies if you test it in guinea pigs. The vaccine is unstable, and if it sits around and thaws out, it loses its potency. So then the CDC says in its materials, in its that should be MMWR materials, that any presumed risk of adverse events possibly associated with the hepatitis B vaccine must be balanced against the expected risk of acute and chronic liver disease. So what's the risk here? Well, here's the risk. Okay, these came from 2 different documents from the CDC. One, they say there's up to 300,000 new cases per year in the United States. There was another document that said about 14,000, which to me that seems like the more legitimate number. But we'll look at both ends of their scale. And what really happens is 95% of them recovered, 3.75%, some of them become chronic carriers, they have the infection, they don't even know that they have it, and unless they're sharing blood products with other people, they're not going to be spreading it around. Okay? The other thing, so somewhere down here, maybe 1.25% of these numbers end up with chronic disease. So we're vaccinating 77,000 new kids per week to prevent 30 years down the road the development of somewhere between 175 and 3,700 cases of chronic liver disease. Now, when you look at the math on that, that doesn't seem like a reasonable thing to me. Well, we're in the process of doing this, and we're trying to prevent long-term liver disease. Okay, is there evidence that the hepatitis vaccine is causing any autoimmune problems? Well, let me see. The Journal of Autoimmunity 1996 says there is no doubt that the nuke recombinant hepatitis B virus vaccine has the ability to trigger autoimmunity. That's autoimmune diseases. Now, what kind of autoimmune diseases are we talking about? And is there a physiological mechanism to explain this? Well, yeah, there is. And this is something that I talked about for a couple of years, and then I actually found evidence of it in the medical literature. You know, you spend enough time, searching this literature, you actually find, because this was a premise that I had. And the premise that I had was this, is that hepatitis B antibody, like if you get a hepatitis B vaccine, you get a hepatitis B shot, and you go get a blood test to say, are you immune? That has to do with healthcare workers, nurses, doctors, which, by the way, as a little aside, there is an exemption from the hepatitis B vaccine for healthcare workers. You do not have to get it. All you have to do is to go to the www.osha.gov website, OSHA, OSHA.gov website, and right on their website is an exemption form that you print out and you sign and you give to your employer. It's national, it's federal, it's not state by state. So if you've gotten the hepatitis, so back to this, if you've gotten the hepatitis B vaccine, there's a point where you go and you get a blood test, and if you have an antibody level of greater than 10 IUs per ml, that is what's determined to be, supposedly, that is considered the standard for demonstrating that you will not contract hepatitis B, that you're immune. Okay? Keep that number in mind, 10 IUs per ml, because when you give a vaccine, now this is the other hepatitis B shot, this Energex B. They don't use this one so much anymore, but it's making a point. They usually use Recomvax. When you get this vaccine, look at those numbers. At 7 months, they did titers at 7, 13, 8 at months. They gave the shots at 0, 1, and 6 months. Out here at 7 months, they drew a titer, and that was the titer. Now compare that to that. So now you've got 2,200 IUs per ml of blood of antibody running around out in your bloodstream. Now, if you're not exposed to the hepatitis B virus, those antibodies don't have anything to do. They don't have anything to do to go and try to kill the hepatitis B virus. You follow that? So then what happens? This is part of the process of the autoimmune diseases, is that if those antibodies are running around with nothing to do, that they can start attacking your tissues. And that is a process called molecular mimicry. And that the structural similarity may exist between the virus and antigens on your tissues, and this may trigger the autoimmune reaction. So this is what this looks like. It looks like this. This is the universal symbol for an antibody. Anything that you read in medical literature, that's the symbol that represents antibody. If this is a bacteria, let's say that's hepatitis B. On the surface of hepatitis B, there's a little amino acid sequence that says ABC. I just made that up, but that does look like that. If you have hepatitis B, that antibody runs around and attaches itself to hepatitis B and kills it. Well, you don't have any hepatitis B. You're not exposed to it. So then what happens is that that antibody goes and finds the surface of your organ tissue and finds a very similar sequence and goes down here and starts attacking it. That's what molecular mimicry does. And why the antibody then, well, you've got all those high antibody levels floating around, and that's just the hepatitis B. Think about what your antibody levels are also very high for all the other vaccines that you're getting. So you got all these antibodies running around in your body with nothing to do because you're not exposed to any of those bacteria or those viruses. So now it finds this other sequence on the surface of a tissue and starts to attack it and break it down. That's what autoimmune disease is. It's that your own tissues start to break down and deteriorate. And this is the mechanism of action that it can do that with. When I actually found this journal article, Vaccination and Autoimmunity, a Danger Liaison, Journal of Autoimmunity, February 2000, that's a relatively recent publication, that actually documents that this is all what's happening. Okay? And it shows that we're using these little antibodies. And what sort of autoimmune diseases are becoming really prevalent in our kids? Well, I just picked a couple. Juvenile rheumatoid arthritis, type 1 diabetes, and Kawasaki's disease. So if you have antibodies running around that find a similar sequence on a joint, maybe this is what's happening, of why we're seeing this rash epidemic of juvenile rheumatoid arthritis. Type 1 diabetes, almost 1 in every 4 kids are now getting it. And the risk of death, people with type 1 diabetes is 20 times greater than those without diabetes. So you suppose that little antibody is finding a molecular mimicry site on the surface of the pancreas. Let's go in there and start breaking it down because you got all those antibodies out there with nothing to do. Okay? What about, there's a disease called Kawasaki's disease, and it's a vasculitis, meaning an inflammation of your blood vessels, most commonly in boys. It can weaken the blood vessel wall and cause an aneurysm. And where this Kawasaki disease happens is on the blood vessels on the surface of the heart. By definition, that's what Kawasaki's disease is. And they actually have a case report, many reports of vasculitis in adults after hepatitis B vaccine, many reports. And then there was a case of a 35-day-old infant that developed Kawasaki's disease after getting his second hepatitis B vaccine. So there is a correlation, and we are causing problems. This is not a benign thing. This is not like, oh, well, while we're here, we'll just give them that shot because, oh, you know, all of you mothers, for sure, are IV drug abusing prostitutes. You know, we need to know that, you know, and so we're just going to give your baby a shot. This evidence can't be ignored. This whole concept of molecular mimicry will apply to absolutely every vaccine that's being given, whether it's a childhood vaccine or an adult one. There is evidence in the medical literature. This is not something that Dr. Tenpenny just made up. This is stuff that's out there, and it really demands a study. It really demands further looking at, and we can no longer say temporal association does not prove causality, because it does.